In 2008, the United Nations General Assembly adopted a resolution that recognizes sickle cell anemia as a public health problem and one of the world's foremost genetic diseases.
Sickle cell anemia is a condition which affects the red blood cells in the body. With more than 100,000 babies born with the disease each year, Nigeria has the highest rate of sickle cell in the world.
September is Sickle Cell Awareness Month, and the aim is to advocate for genotype testing and support warriors. Joining us now on Skype is Toyin Adeshola, Executive Director, Sickle Cell Advocacy and Management Initiative. It's nice to have you join us this morning, Toyin. Okay. All right. Now, the point is, let me start. When it comes to advocacy, this has been on for so many years now. But talk to us from that window. How much of awareness do people have right now about sickle cell and how to prevent it? All right, Toyin, if you can hear me, I'm asking, from the advocacy over the years, how much awareness do you think people have about sickle cell and how to prevent it? All right, we'll have Toyin Adeshola on shortly so that we can get that perspective from her. And the point there is, beyond all of this, the awareness of people is key to all of these.
Absolutely, and awareness for everything is very important because that determines the decision you make and how it affects your life at the end of the day.
And how to handle them.
Absolutely.
Yeah,
We hear she's back on the line now.
Yeah, Toyin. All right, Toyin, if you can hear me now, thanks for joining us on TVC Breakfast. I was asking earlier, with all the advocacy over the years, how much awareness do you think people now have in preventing sickle cell?
Well, I think there's a bit more awareness. Definitely in the last 10 years, there's been an increased rate of awareness for people regarding sickle cell. But I think it's still focused on in the urban areas and semi-urban areas. I think the challenge is where it gets to the rural areas, where it gets to the people with low income, because those are the ones who actually have a large number of children, and because of the ignorance, you see a lot of them still having children with sickle cell. But definitely it's improved, especially the last 4 years. I've seen signs that people are more knowledgeable about it. People have a better understanding of what it means to have sickle cell. But because of the various genetics and various genotypes, there's still a lot of misinformation out there. Because one thing you do is that you have information, yes, but do you have the right information? And that's where we need to come together with one voice to make sure that the right information is being passed on.
How effective is this level of awareness, saying that Nigeria still has the highest number? Is the misinformation that you mentioned the huge challenge causing the gap? Just if you can explain that to us.
Yes, as I said, there's a lot of misinformation, and then the ability to reach the more rural areas is the challenge. Sometimes they feel that, okay, when they say 1 in 4, that narration is not 1 in 4. It's for every child born, there's a 25% chance that you will have sickle cell if you have the AS trait or the ASAC trait. And another narration is that they used to focus on AS, but there's ASAC, which is another type of sickle cell. So there's a lot of information that needs to be passed out, and passed out in the right way, that it's even communicated to them so that they can understand better, especially those who are not so informed or intelligent. Yeah.
All right. Going away from the issue of advocacy, let's get into this practical, what people need to know and what people need to do in preventing this now. Let's talk about that.
Well, the first thing is that you should know your genotype. Go and have your genotype done. And what we recommend is go to more than one place to have your genotype. There's a basic genotype they do in labs, But what we find now is that there are wrong results sometimes given. So we always suggest go to more than one place and a very reputable place. I know money can be a challenge, but in as much as that can be a challenge, it's nothing compared to the financial pressure you might face if you have a child with sickle cell. So it's very important you have your genotype tested, and where possible, if after doing the basic one, go for a higher one called HPLC, which will give you the exact accurate genotype, because there are different variants of genotype. It's more than AAAC, SSSC, there's CC, there's other types of genotype. Even for sickle cell, there's SESD, there's several variations, and beta thalassemia. So it's about being informed about going to have your genotype, then from there making informed choice so that you can reduce the number of people who are born with sickle cell.
Now, another concern is health care, the quality of health care and access to quality health care in trying to create awareness. How much of a challenge, and how have we improved in that aspect?
It is a challenge. It is still a challenge. We run a free clinic for people with sickle cell for this purpose, because we found a lot of people, because of financial pressure, will rather not go to the hospital. They will go to maybe a herbal person or get a midwife who doesn't know much about the management of sickle cell to come into their house and do whatever they can do. So we find a lot more people having more pressure that way, because it makes matters worse. They have to spend money, and then the poor child dies. So healthcare is very, very, very important, but it is not available or affordable for everyone. We need to improve on health insurance so that it will cater for this. We find a lot of health insurance organizations resist putting people with sickle cell on it. Understandable, we're likely to go to hospital a bit more, but that's the only way the average family can survive with the pressures of having a child with sickle cell. So healthcare is very integral, but it needs to be improved a lot.
All right. Thank you so much, Tony.
Now, this awareness month is being observed amidst the COVID-19 pandemic. Talk to us how the pandemic or the virus itself is affecting those who have the sickle cell. Can it complicate issues? Help us better understand.
Yes, definitely COVID-19 virus can affect people with sickle cell, because sickle cell in itself is seen as a pre-existing condition. So most of us try to self-isolate initially, but especially for the older ones, we need to fend for ourselves, and definitely you have to go out. So we've just tried to make sure that everybody maintains the proper safety rules. But definitely it can affect you, and we already have our own complications living with sickle cell as it is. So adding COVID-19 virus, it will be a challenge trying to manage it. And some of the complications even sometimes manifest as if it's some of the symptoms of COVID-19. So sometimes it's conflicting if doctors don't really know what they are doing.
All right, now let's talk about the issue of support for warriors. We know a lot of people are doing everything possible to fight it, and which we also support them. But basically make us understand what area of support is needed from people, family, and even the society.
Well, of course, the typical one is financial support to be able to provide proper health care for families. But I think the most important for me is the emotional and psychological support, because sometimes we think people with sickle cell have either lazy or cannot live till 21 and all these myths that come about, or they can't marry or can't have children. So we need that emotional stability of encouragement, of empathy from society. There's a lot of stigma, a lot of things have been said about people with sickle cell, which are wrong. And of course, it affects us in getting jobs, in finding relationships. And so we need more information to a chance with sickle cell to live healthy and positive lifestyles.
Now, talk to us how best to perhaps commemorate this month. For some persons, from reports, there is the push for perhaps blood donation.
Yes, blood donation is very important. A number of people with sickle cell face anemia, and that's why it's called sickle cell anemia disorder. And we sometimes need to have blood transfusion. We also sometimes need to have what you call blood exchange transfusion, which is a replacement of the S cells with typically A phenotype, so that they don't have as much complications. So blood is very integral, but also in terms of just telling your neighbor about sickle cell, being informed about sickle cell first, telling your neighbor about it, so that it reduces the level of ignorance around sickle cell, because there's still so much ignorance concerning sickle cell, and there are different narratives that people get cross-conflicting information about what sickle cell is really about.
So as this month is dedicated to the creation of awareness, how should the month, in your mind, what do you think this month should address precisely in specific terms if activities have to be carried out?
Yeah. Okay. First of all, like I mentioned earlier, more awareness on supporting people with sickle cell, breaking the ignorance. Then also increasing knowledge about sickle cell bill that would help support every aspect of challenges people with sickle cell have. Providing proper adequate care in hospitals. Most importantly, training doctors, because you'll be surprised, a lot of doctors don't know about how to manage sickle cell. So we want issues dealing with training doctors to be brought to the fore, so that there'll be more access to good doctors that can take care and manage people with sickle cell.
Tonya Adeshola, thank you so much for your time on TVC Breakfast.
Thank you very much.